I would like to ask you both permission to use this video for educational purpose and on the internet.
Yes.
Yes.
Okay, thank you. I appreciate that. Now, tell me about your symptoms before the surgery.
Okay. Before the surgery, I had a headache 24/7, pain in my neck, and pain in this arm. And I knew I didn't want to be like that for the rest of my life.
How bad was that pain, 1 to 10?
I usually said like an 8.
8. That's a
Yeah.
significant pain. What did you notice? What could she do and what couldn't she? What could she not do
Before?
before the surgery? Yeah.
Well, she did everything, but she wasn't happy about doing
Yeah.
anything because she was in pain.
Yeah. Yeah.
But otherwise, she did. She drove and
Yeah. But it was everything was painful.
everything was painful.
Yeah.
She was miserable with the pain.
Absolutely, yeah, and you had a reason to be miserable. Your spine in the neck was completely collapsed, bending the wrong way, pushing on lots of structure, and it was in a really bad shape. The surgery was not a small surgery. I'm turning around. This is the surgery we did. We did a occipital to T2 fusion, and that surgery just was 1 month ago. And we did in that surgery practically went there and put screws in the skull and most of the spine. And even we went all the way down to thoracic region to support all the construct, going all the way from the skull, practically turned your spine the correct way because your spine wasn't bending this way, it was actually bending the other way. And then the metal is to hold it in place. That was a big surgery. How long did you stay in the hospital?
3 nights.
3 nights.
Yeah.
Which is not bad for this kind of surgery. May I go around, look at the incision on your back?
Yes.
So I'm going around and looking at the back, and practically we cut it. I cut the hairs from here down, and the incision goes all the way down, and it's a little reddish, but it's not unusual for 1 month after. So strip will fall soon, and usually it fades away. It gets better now. How was it after the surgery? Describe it realistically, what you felt and how it was.
The pain, the headache, the pain in the neck and the arm, that was all gone right away.
Right away.
Yeah.
Okay.
Yeah.
But obviously it's tough to have a surgery like that.
Yeah, and there were a lot of restrictions, and I did have pain and a lot of limitations when I got home. And I know you had said that after a month I'd be feeling a lot better,
Okay.
And about 3 weeks after the surgery, I was thinking, yeah, right, Dr. Abbasi, this is not getting a lot better.
Okay.
But this last month or week,
Last week.
it's made it. I just can't believe how fast things
Yeah.
came around.
So I wasn't quite lying. So
No, you
and that is
weren't.
based on experience because we have done these surgeries on many patients. We know the first month your body is just struggling to get over the surgery, and any surgery is a trauma, any surgery is an injury. And most of my patients with this big kind of surgery, the second month is where they notice. And they are as well very surprised. When I tell them, it's going to get better, they say, I don't feel it. But then the second month, they start noticing now. You said the neck pain, the headache, and the shoulder arm pain and so on, that was gone right after the surgery.
Yes.
So what was it that you were struggling with? You noticed that is a different kind of pain, correct?
Well, yeah.
Yeah, it was a surgical pain.
Right.
What did you feel? Tell me about it. Describe it so my other patient with similar situation understand what to expect.
Well, I guess it was, I did not feel I didn't feel pain where the incision was.
Yeah.
And I didn't, then when I started doing more things, I got some pain across the top of my back, which I don't know, just from using muscles I hadn't used, or I guess I don't know why.
Yeah, but it was just generally, it was tough. The first 3 weeks was tough.
The first 2 weeks she slept a lot.
Yeah, good.
She slept a lot.
Your body needs that, need to recover from the surgery.
Yeah.
Yeah.
And then she found out that she was her hemoglobin was low.
Yeah.
So now she's on iron pills.
And that
Yeah.
made
But when she started taking iron pills, then she really perked up from that.
Okay, well,
And sometimes I think maybe she's feeling too chipper.
Yeah. Well,
Because-
she's tiny. Look at her. She's tiny. She needs all the resources, all the help she needs. Okay.
Yeah, I mean, she's,
Yeah.
you know,
Yeah.
just around the house. I mean,
Yeah.
she knows what not to do, but
Okay.
I don't want her to fall. That's what
Yeah,
worries
and
me.
that's extremely important. You just told me you don't use even this cane around the house anymore. So
No.
walking is getting better.
Oh, yeah, yeah.
Now, with this kind of fusion, actually, we fix the neck in a permanent position. And practically, we take all the motion of the neck away because there's no good motion left. How are you coming along with all the way from your skull to your chest, bone being growing together? How are you coming along?
Well, I wear the brace most of the time, so that would kind of hold it in place
Mm-hmm.
anyway. And even before the surgery, I had very limited mobility because of
To start
pain.
with, yeah.
So
Do
I
you
know
notice that you can move more or less now?
oh less, yeah, I do notice that.
Yeah,
Mhm.
but overall your daily activity is still getting better.
Oh,
Even
yes.
though the neck moves less, the pain is gone, then you can do more in your daily, and we will teach you. We will teach you many activities, including when driving, how to drive with not being able to move the neck. But this is in your situation, unfortunately, this was the alternative, you know, bad, truly very bad pressure on the spine and severe pain, and even possibility that more pressure would take the function away, or fixing it in a permanent position and making the pain go away. And now we have to teach you how to live with the new neck.
Yeah, I'll get used to it,
Yeah,
but it'll take
most
time.
of people do. Most of people do. Well, any other comment or question for me?
Oh, I'm really glad I had the surgery.
And what do you notice since the surgery? How she's coming along?
Well, like I said, the first 2 weeks she slept a lot.
Yeah,
But then after that, you could tell every
turning
day
around.
there was improvement.
excellent. And this
Because
is
just the things that, you know, that she wanted to do or did.
mhm.
And
And that is what you're describing is a typical thing we see. And we are just 1 month after that big surgery. That's not a very long time. But we get there, okay? Well, thank you so much for the interview. I appreciate that.